The ProCell sponge blood recovery unit is sterile, compact, disposable, and comes fully assembled right out of the box. Standard OR wall suction provides the necessary power to activate ProCell. Typical activation time is 30 seconds to 1 minute. Contents include one ProCell sponge blood recovery unit consisting of 3 individual components: the lid, reservoir, and sponge basket. Drop the sponges into the sponge basket. Replace the lid. Attach the suction tubing to the vacuum port. ProCell operates on vacuum commonly found in the OR. Use a dedicated suction line that is not connected to any other devices. When necessary, set the regulator to bypass or full vacuum mode to ensure an operating range of 300 to 500 millimeters of mercury. The lid will automatically deploy downwards. Suction tubing attached to the vacuum port must be detached before the lid and sponge basket can be removed. Tilting the lid in between activations can facilitate easier access to the sponge basket. ProCell is a blood collection device only. It does not filter or otherwise process the recovered blood. The intraoperative autotransfusion equipment must process the recovered blood before it can be reinfused back into the patient. The ProCell reservoir has a capacity of 500 milliliters. However, it's recommended that recovered blood be sent to the IAT equipment as soon as possible after each activation or after a series of rapid activations. To send recovered blood back to the IAT equipment, simply place the IAT-connected suction tip into the open reservoir. The ProCell sponge basket can accept a wide variety of surgical sponges. It's not necessary to separate the sponges before being placed into the sponge basket. The following is intended as a guide only. Ensure that all blue radio-opaque tags are set within the lower end of the sponge basket to avoid interfering with lid deployment. For added convenience, an optional 3-way stopcock may be used to avoid having to detach the suction tubing in between activations. The following stopcock installation sequence to be conducted on the sterile field. Suction tubing. Suction tubing cut. Stopcock installation. Ensure all caps are removed. Off to air to activate. Off to suction to remove. Operator checklist. Select a suitable location in the sterile field within direct reach of the operator. Place on a flat surface where ProCell can remain upright during activations. Use a dedicated suction line. Set the regulator to bypass or full vacuum mode if necessary. Ensure suction operating range of 300 to 500 millimeters of mercury. Firmly attach suction tubing to the ProCell vacuum port to activate lid deployment. Clamp suction tubing to avoid recoiling in between activations. When removed from packaging, it's helpful to first remove the lid and sponge basket as one unit. Then hold the sponge basket with one hand while the other twists and pulls the lid out. At the end of the procedure, ProCell should be handled according to your hospital's protocol for disposal of biohazardous materials.